Okay, here is case number 4, a case that has some spacing we like to get closed. So we generally follow the exact same protocol in our previous cases, and that is the first thing we're going to work on is the rotations, and then facial, lingual, and mesial distal tooth movements. Okay, so I'm going to go ahead and click on Create Ideal. I'm going to set these parameters at 0.2 and 1.5. Okay, and I'm going to basically just split the difference between these two front teeth here, and I'm going to grab this central, mesialize it to close the space. So I've moved that over basically 0.9 millimeters, and then this tooth here 0.98. Okay, so that's just sort of the slight deviation in terms of how we treat the case. So essentially, not exactly even between the two, but off by a tenth of a millimeter, which is very small. Now we're just going to work our way around the case. Okay, so I'm going to click on the lateral, bring this mesial, and when you're closing spaces, it's actually good to even get the teeth to overlap a little bit. Okay, and what I mean by that is have the the mesial surface of one tooth also interlap or also slightly penetrate the distal surface of the other tooth when we're closing spaces. It kind of builds in a little bit of overcorrection. So this tooth, we're going to move mesial, and I'm going to rotate. You can also, you can also grab the center of the gyroscope and move the tooth in multiple directions. Now I'm going to rotate. And rotate this around so it fits up a little better. Okay, and now we're going to do the exact same thing but on the opposite side. Mesialize this and also push it a little bit lingual. Mesialize. Again, we're not looking for perfection here. This is just to get us in the ballpark, just to get us 90% of the way done. Okay, so now I'm finished with the upper arch, and now we're going to go to the lower arch. And the first thing that we're going to do is center the midline. So you can see here that this central could go over a little bit. And now I'm going to move this central over a little bit. And now we are ready to start setting up the lower arch. I rotate up to the occlusal. and we follow the exact same protocol. And that's going to be to first work on the rotations, then work on the facial, lingual, and mesial distal tooth movements. And we can move all these teeth en masse together to close that space that's distal to the cuspid. And now we're going to go lingual just a little bit. Okay, and now we're going to go to the right side and move this mesial, work out the rotation, and a little bit distal, sorry, a little bit lingual. We'll take this cuspid, bring mesial in the right position next to that lateral, and then now we're going to take this group of teeth here and mesialize them to close the space. Oh, wrong way. Okay, almost there. And one more click should probably do it. Okay. And I can unmove that lingual just a little bit. Okay, and if you were paying attention, I forgot to do the intrusion, extrusion, and tipping sequence. So let's go ahead. I'm going to just hop. So if you skip a step, that's okay. Just go back and finish it up. So again, I like to start on usually the upper left side. Just rotate around. See if there's any sort of tipping, intrusion, extrusion that can be done to improve the patient's tooth positions. To me, her cuspids look fairly prominent, so I'm going to go ahead and do some intrusion of those cuspids. You can see I highlighted both of them at the same time, and I'm going to intrude both of them at the same time. Okay, and then that is complete. So let's go down to the lower, and on the lower we're going to do the same thing now, and we're going to look for any sort of intrusion, extrusion, tipping movements that may need to be completed. This cuspid here looks to me like it can have a little bit of distal root tip. And we do have some uneven incisal edges, so I'm going to actually intrude these laterals together. And again, the way you select multiple teeth is just hold down the control key and then click on those teeth with the mouse, and then they'll both highlight red. Okay, and you know, these sort of little uneven edges, I'd probably take care of the little enameloplasty at the finish. Okay, let's look at the upper and lower together. Looks good. All right, now we are going to determine the number of tooth movements needed. Now remember, it's about 90% complete here. It's not perfect, but the whole idea is get us to close to the finish, and then when we're close to the finish, that's when we'll go in and fine-tune the tooth movement and take her all the way to completion. So let's look at our tooth movements over here and look for largest displacement. We've got probably the largest displacement is going to be the 2.54 millimeters of lingual movement. So, oh no, right here, 4.8. So let's go ahead, 4.8, divide that by 0.3. That's going to give us, so let's make the numbers easy. Let's do 5 divided by 0.3, and that's going to be 15. So we'll enter 15 intervals. Click OK. And look at our tooth movement velocities here. It's a little bit too fast, 0.33. Okay, so we're just going to go in, go to Edit, Undo, create intervals, and now we're going to do 16 intervals. Click on OK. And we're at 0.31, which I think is probably okay. You know, we're off by such a small amount. I think we'll be fine, even though we're right at that, you know, slightly above the maximum tooth movement for a couple of the teeth. But I think we're okay. So that is basically how I would treat this case here. But again, so we have 16 setups. I probably have maybe the first 12 printed, get the patient through those first 12, then evaluate if the patient's tracking well. Then I continue on, maybe to sort of fine tune towards the end, or I would rescan or re-imp at 12 based upon how the patient is tracking. Okay, hope that's helpful, and I look forward to seeing you in video number 5.